Just because an MRI shows that you have labral tears doesn't mean that's causing your pain, and it doesn't mean that you need to have surgery. Dr. Nicholas Mercer with you, Improve PT. There is a lot of research showing how imaging from techniques like MRIs and X-rays and CAT scans don't always show the whole picture. Today I'm going to be going over a few studies that look at the prevalence of labral tears in the hip and determining whether that labral tear is causing symptoms. A lot of these subjects, the participants in these studies, were not having any symptoms, yet they still found labral tears on the MRIs, and it just kind of shows how dangerous it can be to make a decision simply based off of imaging and not on a whole variety of tests and symptoms and observation in addition to the imaging. The first study that we're going to look at is called The Prevalence of Acetabular Labral Tears and Associated Pathology in a Young Asymptomatic Population. So in this study, they took 70 participants with a mean age or an average age of about 26 years old, all of whom were not having any symptoms of labral tears. So what they found was out of those 70 participants, 27 of them had labral tears somewhere in their hips. For some of these patients, there were other intra-articular findings, so there was other things going on in the hip besides the labral tear, but for most of them, it was just a labral tear. Now, what's significant about these is that asymptomatic portion. These young people, again, mean age of 26 years, were not having any symptoms, yet they had labral tears on an MRI. And the authors in this study go on to explain how FAI, or hip impingement, is related to labral tears and can actually cause labral tears, but they didn't really go into specifics on how many of those asymptomatic participants had FAI show up on their MRIs. Now, 8 of the participants had a positive anterior impingement sign, and 6 had a positive Faber test. And these tests are usually used to screen for labral tears in the hip. It's common tests used by physical therapists. However, alone, they're not enough to confirm a labral tear because there are a lot of different things that can cause a positive or negative result on these tests. But when we combine the MRI with these tests, it can kind of give us a better overall picture of what is going on in the hip with that labral tear. So the significance of this study in particular is very important, because if there's anyone out there who's like me, who before they had surgery, they weren't even having hip pain. So I had FAI and labral tear surgery because I had knee pain, and they found stuff wrong on my x-rays and MRIs, so they decided to do surgery on the hips. I was told that would make my knee feel better. It didn't, and it made my hips feel worse. It just goes to show you how important it is to confirm where pain is coming from. So I was told that my knee pain was coming from labral tears and FAI. Had the surgery, now my knee hurts and both my hips hurt. So we really have to use a lot of different resources and be very, very confident with what is actually going on in the hip, what is causing the pain, because if we have the surgery and we have more pain, or we have the exact amount of pain, even if the labral tear was fixed, did you actually need that surgery? And moreover, you're still having pain, so now there's a whole different problem that you have to figure out and solve post-surgery. So the big idea here is we can't just take one imaging technique or one result and just assume that that is what's causing your pain, because there's so many different things that can be causing pain, and a lot of things, a lot of conditions, syndromes, symptoms can correlate with labral tears, but that doesn't necessarily mean that that labral tear is causing that pain. Now, another study that I want to look at is called Prevalence of Abnormal Hip Findings in Asymptomatic Participants, and this was a prospective blinded study. So what they did was they took 45 participants and they had them do an MRI on a random hip. Now, these participants had no history of hip pain, symptoms, injury, or surgery on those hips. The participants in this study was about 38 years old. This is pretty significant. because in 69% of the hips that they tested on these asymptomatic participants who had never had hip pain, they found labral tears. 69% of these people had labral tears with no symptoms. Now, they looked at a lot of other issues in the hips, like 24% had chondral defects, so defects in the cartilage. 2% had tears in the ligamentum teres, some labral, paralabral cysts in 13%, acetabular bone edema or swelling in 11%, some fibrocystic changes of the femoral head and neck junction in 22%, some other things that you would think would cause some pain in the hips. In total, 73% of the hips in this study had something wrong with them. And there was a strong correlation between the age of the participant and the markers of cartilage degeneration that will happen kind of as you age. So again, this is significant. It shows that, as you age, some of these defects, some of these abnormalities on MRIs and other imaging techniques will show up. But does that mean that we have to go in and fix them and make them perfect if we're asymptomatic? If we're asymptomatic, we're not having any issues. We don't even know we have hip issues, and it's not necessarily detrimental to just leave it how it is. There's some conflict on whether or not labral tears will lead to arthritis, but overall, a few studies have looked at this, and labral tears alone are not indicative of it progressing to arthritis. There are other factors that go into it progressing into arthritis and eventually maybe a hip replacement. However, labral tears by themselves aren't incredibly indicative of that progression to arthritis. So this shows that, even as we age, for instance, these participants were 12 years older than the participants in the earlier study, we may have more frequency, we may see labral tears more common, but if labral tears can happen in a hip that is not having symptoms, imagine how many people are having hip pain, they get an MRI that shows labral tears, we assume the labral tear is causing the pain, and we do surgery. And then after the surgery, maybe we get better, maybe we don't. Maybe we still have that pain, and now we have surgical pain, and now our hips have a bunch of scar tissue from incisions and basically reworking how the hip moves and functions. Now, the last study I want to look at is called Computed Tomography Assessment, so that's a CAT scan, of hip joints in asymptomatic individuals in relation to femoroacetabular impingement, so FAI or hip impingement. So in this study, they took 50 individuals. Their ages actually ranged very widely. It was from 15 to 40 years of age, and they looked at both hips. Now, these participants had gone to the hospital for some type of abdominal pain, but none of them had any history of hip pain. And basically the abdominal pain is relevant because that's why they got the CT scan, but the CT scan allowed us to look at the state of their hips. Because they were asymptomatic, there was no real reason to look at them from a hospital perspective, but in research, when we have information available to us and we don't have to do imaging specifically for a study, it makes that study a lot more affordable, and it makes that information a lot more accessible, and we can draw a lot more conclusions without having to spend more money. That's basically just the relationship of the abdominal pain to looking at the hip joints here. So what they found, again, 100 hip joints from 50 patients, no history of hip problems. 39% of the joints had at least one morphologic aspect predisposing to femoral acetabular impingement. So a majority of these were bilateral, so 66% of them had it on both hips. And basically they found 39% of the joints had some type of femoral acetabular impingement. Again, these are people who did not have any hip pain. So this just goes to show how important it is to make sure that whatever's on imaging corresponds with several different tests, symptoms, movements, strength assessments, flexibility, joint mobility, and overall just like the big picture. We can't just look at an MRI or a CAT scan or an X-ray, find something wrong, and immediately say that's what's causing the pain. Because I'm a real life example of this. I had knee pain. I was told, oh, you have FAI and labral tears on both hips. That's what's causing your knee pain, because I wasn't having hip pain before my surgeries. So, got surgery, now both hips hurt and my knee hurts. My knee pain was not being caused by FAI and labral tears like my surgeon told me. But now my hips hurt and my knee hurts. So, it's just, the whole reason I wanted to look at these studies was to show you how important it is to start with conservative treatment, not just going straight to surgery, because again, those symptoms are not always caused by what shows up on the imaging. If you can live your life without having any symptoms, who cares if you have a labral tear? Who cares if you have some extra bone on your femur or your acetabulum? If you're not having symptoms, chances are there's not a lot of damage being done to the hips anyway. And there are several studies that have looked at labral tears progressing to osteoarthritis, and it's not necessarily that if you have a labral tear it's going to progress to arthritis. It's other factors associated with the labral tear, so other things that are coming into play, genetic factors and a lot of different factors will determine whether or not that's going to progress to arthritis. And even without the labral tear, who's to say it's not going to progress to arthritis anyway? But if we can manage these symptoms or manage your hips without surgical intervention, that's the goal here. And these 3 studies show that just because you have those anatomical differences on an MRI or imaging doesn't mean that that's going to fix your problems. However, if we go through physical therapy treatment and we do conservative treatment to help clear that hip impingement, FAI, labral tears, basically make your hips move like hips again, and we get rid of the pain, you don't need surgery, you don't need that buildup of scar tissue, you don't need someone going in there and reworking the whole anatomy and structure of your joints. And that is exactly why I created the hip impingement solution. This is a program that I've been working on for a very long time, taking the skills that I learned as a doctor of physical therapy, working on patients who've had hip impingement, FAI, labral tear symptoms, and have effectively been able to go about their everyday lives managing their symptoms, and without surgery or even after surgery, still getting relief from the treatment, from these exercises and techniques. Now, everyone's a little different, and that's why I made 15 self-tests for this program that will find your specific deficits and then point you to the exercises and techniques that are most likely to help you with your problems, with your hip problems, specifically hip impingement, FAI, and labral tears. So, something I'm very passionate about, so if you would like access to this program, please look for the link in the description below. If you're not quite ready to start this program, that's okay. If you'd like to talk to us about your problem, get in touch with us, please go to youimprovept.com, send us an email. We'd love to have that discussion with you and really understand you and your story, how you've been suffering from aggravating pinching in your hips or whatever it may be. And again, if you're not ready for that program, that's okay. Look around our YouTube channel. We have a lot of videos on hip impingement that may help you a little bit. Again, not a magic bullet. None of those videos are a magic bullet. It's not going to fix your hips, but you may find some relief from some of those videos and just overall get more information on what's going on in your hips. So check out the program in the description below. I will link a card here for the hip impingement playlist on our YouTube channel. And overall, just get ready to improve your pain, improve your movement, and improve your life.